Hey guys, it's Jay again. I'd like to welcome you back to Respiratory Therapy Essentials for the TMC exam. If you are a respiratory therapy student or someone seeking to take the TMC exam, you're in the right place. I'd like to welcome you and those who are here just to learn a little bit more about respiratory therapy. Now, as you can see on the board, tonight's video is about intubation. Now, when do you intubate and when you do not want to intubate? That's our subject for the night. And listen, if you like this video, hit that like button, subscribe to my channel, turn on your post notification because we're giving video every single week on content related to the TMC exam. Let's go. Okay, guys, we're talking about intubation tonight. And if you will look at Roman number 1, I only have Roman number 1 and Roman number 2, which means this is a short video. But all of this information that's on the board, you must know before you sit for the TMC exam. Now, Roman number 1 says intubate. When do you want to intubate a patient? The pH must be less than 7.25 due to an increase or rising in your pH CO2. Now, we're not talking about a situation where the patient have a diabetic ketoacidosis, all right? But when the pH dropped to below 7.25 because of that CO2, you need to intubate, all right? Another reason to intubate is when the patient is unable to protect his or her own airway. There's no question about that. You should not wait around. If they cannot protect their airway, you must intubate them. If the patient is unconscious or comatose, unable to follow commands, if the patient is confused and disoriented, then you should know that they need some way for the airway to be protected. Obtunded is written in red on this board. You, without a doubt, must know this definition of this word, and when you see it, it almost 99% of the time telling you that your patient is unresponsive and you must act immediately, intubate them. If there are signs of aspiration, if the patient has neck trauma, you must intubate them, okay? Because again, there may be a problem with paralysis and they're unable to protect their own airway. Go ahead on your trauma patient, especially neck trauma, and intubate them. Now, you have to know that this is invasive ventilation because you are taking over their ventilation. When we're intubating someone, we're telling them, I no longer trust you for your own breathing, okay? All of the signs are there. I'm taking over the breathing for you. And this is invasive, but you know what the signs and the symptoms are. Go ahead and intubate them, all right? Now, don't be hasty to intubate, which means when do you not want to intubate? All right. If the patient has not yet reached complete ventilatory failure, which is indicated by what? The pH. If the pH is 7.25 or less, all right, they have not yet reached ventilatory failure. Only when that pH drops below 7.25 is when you want to intubate. If the pH is between 7.26 and 7.32 due to a rise in the pH CO2, you don't need to intubate them. The patient is able to cough on command and able to expectorate their own secretion. You do not have to intubate them, all right? That's telling you that they can clear their own airway. All right. If the patient is not disoriented or not confused, don't intubate them. Do not intubate them. Okay. It may be that we might just want to put them on CPAP or BiPAP or just watch their ventilatory parameters or their ventilatory effort, but you don't have to immediately intubate them. We intubate only when necessary. And for the TMC exam, you will have to make the decision both ways, to intubate and not to intubate. You would have to do both. You will be challenged not to intubate, and you will be challenged to intubate on the TMC exam. Okay? If you put a person on the ventilator, by intubating them, if you put them on the ventilator, you must remember we have to get them off as soon as possible. Put them on, get them off as soon as possible. Okay? And there you have it. Okay, guys, it's important that you know when to intubate and when not to intubate. And the information on the board will assist you in making that decision. Okay? Now, I need your help, guys. If you like this video, hit that like button. Subscribe to my channel. Turn on your post notifications because I'm giving you a video every single week on TMC Essential for the TMC exam. And until next time, we out.